Well, with the new ruling, the new Supreme Court ruling on health care, it has a lot of people wondering what it means and also how it will affect them. So today I'm joined by Dr. Stephen Lana from Delaware Pediatrics. And what does this mean for the average person?
It's a win for the average person. It's a win because it allows young adults to stay under their parents' insurance until they turn 26. It's a win because it allows a lot of individuals with private insurance to receive access to primary and preventive services without having to pay a copay. And it's particularly a win for individuals with pre-existing conditions which heretofore were denied by many insurance carriers the opportunity to buy health insurance.
And so how will this affect doctors and other people in the healthcare profession?
Well, it will create more of a demand for primary care services, so it might create a bit of a crunch in terms of being able to offer those services. We need more doctors going into primary care, which gets to how the bill didn't go far enough. The bill didn't go far enough because it didn't really address tort reform, didn't really address some of the exorbitant profits that pharmaceutical companies are making. So without those sorts of reforms, putting more people into the primary care pool without having more primary care doctors capable of providing those services is going to create a bit of a crunch.
So it's going to be harder for people to see their primary physician?
Well, potentially. I mean, if we had approximately 10% of the U.S. population, some 32 million people, have been underinsured or uninsured. Now, some of those people chose to be uninsured because they basically roll the dice and think, well, I'm not going to get sick, so why should I pay health insurance? Those people that do want primary care services and were unable to afford them, who can now afford them because the government will, in effect, help them subsidize their ability to buy health insurance, that introduces a new pool of individuals who are going to need services. So in some instances, in some sectors, in some parts of the country, it may be difficult.
All right. Well, thank you so much for joining us today. We really appreciate it.
My pleasure.
And we're going to go ahead and toss it over to Lauren Hall with your .com check.